on our website and in additional email follow-up. We're going to give everybody a couple minutes to arrive if you want to just start entering your name, where you're located, anything you're looking forward to learning today. Thank you. All right, before I move on to the learning objectives today, I wanted to review some housekeeping and reminders. You can hear us, but we cannot hear you. You can use the Q&A icon at the bottom of the screen to ask any questions you might have, and we will have a portion at the end of the session for questions and answers. If you wish to have closed captioning turn on, there should be a button on your screen that either says CC or closed captioning. We will also have a set of evaluation questions at the end of the webinar that we encourage you to complete, as it helps us to provide the best content and tailor it to the voices of those in the field. Today's learning objectives are to understand the unique physical, emotional, and health needs of adolescents, define principles of youth partnership models, and engage youth as leaders that prioritize adolescents' health needs, describe youth perspectives on starting or enhancing collaborative partnerships with schools, families, and community organizations to support adolescent health initiatives. I'd like to take a quick moment to introduce myself. My name is Mandy LeBlanc. I get to be a contractor with School-Based Health Alliance. I have about 20 years of experience between healthcare, schools, and school-based health. I'll pass it over to Donnie to introduce himself.
Hi, everyone. My name is Donnie Greco. I'm an associate here at the School-Based Health Alliance. I've been here for about 3 years and am based in Pennsylvania, right outside of Pittsburgh.
Hello, everyone. I'm Kari Bennett. I'm the Youth Ambassador for the School-Based Health Alliance of Arkansas. I go to Magazine High School, and I'm a sophomore.
Hi everyone, my name is Amaris Lopez and I live in New Mexico and I'm currently a junior in high school.
Hello everyone, my name is Elena Shvaya. I'm based in the Eastern Shore of Maryland. I am a 10th grade student at Gunston High School and I attended the Be the Change conference.
Hi everyone, I'm on the Youth Advisory Council for the National School-Based Health Alliance, and I'm a student at Washington University in St. Louis.
And welcome everyone. My name is Selena Moore and I'm Vice President at School-Based Health Alliance. To get us started, we'd love to hear from you all some more. Thanks so much for sharing in the chat who you are and where you're coming from. We'd also love for you to share in your day-to-day, how do you show up for you? It could be to your job, it could be in your personal life, but how do you show up for youth and what does that mean to you? So we'd love to hear from you so that we can engage as much as we can in this conversation and understand, where you all are coming from and your background and what youth partnership already looks like or how it exists in your settings. So as you share those, we'll continue on and share a little bit of background before getting into more great conversation. It's already flowing in, so great to see from each of you that you provide mental health therapy and that you have 4 children of your own. That's so wonderful. Thank you for sharing. This presentation / conversation today is a continuation of an e-learning video series that is available on the School-Based Health Alliance website, Creating and Sustaining Adolescent-Centered Health Programs. So it's of the same name. And there are 3 videos that focus on key areas of youth development and ensuring that your centers are adolescent friendly. So starting with the youth adult partnerships in health center settings, design thinking in health center programs, and health center outreach and engagement. So you can also utilize those tools together or separately as it's helpful to you. The link is in the chat for easy access. Thank you so much for those of you who are continuing to share that you provide a youth adult partnership model to help students design mental health projects and projects to promote their SBHCs. That is really awesome. And I hope that you all are taking note of, sharing with each other. You might want to connect after with this and learn more about what each of you are doing. So we're all great learners here. I contract with SBHCs to provide project management as they're getting started. I am a provider at two SBCs that provide service K through 12 and provide autism evaluations for those in our community. Awesome. Really exciting work. And so some of this might be familiar to many of you at any level, and we're focused on adolescents and into young adulthood today, but it definitely runs the entire child and adolescent spectrum, that there's a lot of different needs, from the physical to the mental and behavioral to the education and community. And if any of these that you see on the screen resonate with you, definitely feel free to share in the chat how you're seeing those needs play out and maybe how you directly serve. And those, we've already heard from some of you that you work in the SBC, so you're seeing this every day and working so hard to address these needs. And along with these needs, there also are additional aspects in terms of the barriers that we see. And those can also go across many aspects, from the personal, whether you're looking at just the knowledge and the awareness, barriers to knowing that there is an SBC in my school. There's so many times like working with young people and they're like, I just found out and I'm now a senior, but this was here the whole time. Or not being able to get to appointments because parents have to work. They don't have their own transportation. They don't live in an area that has readily public transportation. So then how do they get to appointments if they're not at the school or somewhere easily to access? There can also be social barriers, the peer influence, which is an aspect that we're going to touch on later, but sometimes you might feel embarrassed or think it's just me, or ashamed, or it could be coming from the side of thinking, oh, within my community this isn't really talked about, so I shouldn't bring it up, all the way to systemic barriers. It might be provider shortages, or the geographic barriers. And I want to continue to highlight more what we're seeing in the chat, providing spaces where you can show up as their genuine selves and share that experience with other youth. That is so, so powerful, and leads us right into the next aspect, which is, how do you even be able to have that space where they can show up as themselves, building the trusting relationship. And that's really the foundation of it all, whether you're front office staff and you're checking them in, to the provider, to the person who's calling them about follow-up or trying to engage them in other programs, really thinking about the community. You have the community within your centers or org, but they have school community. You have different groups and clubs, you have larger community. How do you build awareness that centralizes and brings everyone together? And then particularly for those who are serving them directly, whether it's in a provider adolescent communication like this, or just adult to adolescent communication, what does that communication look like? Is it bidirectional, or is it one-sided? Are we really able to create that space that opens up for open dialogue and sharing? So we're going to continue to talk more about that next. And it seems like from what we're hearing in the chat, for many of you, this is not new, but consider that whether you have a direct connection working with young people every day or not, or your job's completely removed from that, and you're like, well, I work on the finance, or I work in the research, I work in the policies. We're all youth workers. If you're working for an org, for a school, for a health center that serves young people, even if you're not the one directly doing that, the mission is to provide wonderful care, to make things happen for you, then you are also a youth worker. So that's a frame of mind that we just always want to live in and follow. And with that, then as you think about that and expand on what it means to be a youth worker, there's so many different stages and strategies and approaches that you can take in this work. And you're going to hear about a few of these as we continue on. We'll also talk a little bit about partnership models, and if there's ever an interest to delve deeper in these, definitely reach out to us. But we just want to highlight, and you'll learn about this if you watch the youth partnerships video, that both youth-led, youth adult, and adult-led are wonderful ways to think about your partnership with youth, depending on whether you're running an activity or a program or the services. Any one of these might be in play simultaneously, or one might take the lead at a time, but they're all ways to think about how you're working together as partners. And a few recommendations as you engage youth as leaders, if this is new for you, a couple that we'll just highlight is, again, that relationship aspect, establishing expectations and making it practical. You want to ensure that there's ways that it makes sense for both what youth want for their own outcomes individually or for their peers, match with the capacities that you have with your staffing and your funding to make it something that not only you can do now, but that you can continue into the future. And lastly, with every opportunity, just always asking yourselves, where is the youth development or youth in this project, this initiative, this grant, this meeting, this conversation? Again, anything that's supposed to be about or for youth, they ought to be there too from the very beginning to inform what this looks like. And how can we ensure that it happens in a way that's mutually beneficial? And equally as important, what kind of funding do we have to support this in kind or with direct dollars to make this sustainable and impactful for young people? So that's a little snapshot, and we're really excited to bring all of that into the fold in a way that is both in reality and impactful. And we're so excited to have with us four wonderful youth from across the country to really highlight what it means to center young people in healthcare and in health centers, and hearing directly from them as they're representing great work that they're doing across the country. So Kari, Kaiten, Elena, and Amaris, really excited to have you all here today and to share your insights and the powerful experiences and the work that you do. And so if we think about, the bigger picture, when we say adolescent-centered or youth-centered care, what does that actually mean to you?
I can begin. So, to me, youth centered care means we're not just patients, we're a part of the conversation. And it's care that actually fits into our lives and respects our voices and doesn't treat us like we're too young or like we're too young to understand what we need. It's flexible, judgment free, and built with us, not just for us.
Yeah, I would say, and just to kind of add on to that, I would say that like, in addition to creating a safe space for youth, it's actually involving them in decisions and not just marketing it as something that's involving youth in decisions, but actually involving them in big decisions. And an example could be, I was recently elected on the board for the School-Based Health Alliance. So in this upcoming term, I'll be able to like actually sit alongside like adult board members to actually make decisions for this National School-Based Health Alliance. So I would say that that's adolescent or youth-centered care, involving youth in decisions, not just saying that you are.
I, I would like to say that I think youth-centered care is really about the journey to health and how to cope with those hard things that are going to get you through your life and help you become a better person and show the youth that you can do hard things.
Being able to kind of sum up what everyone said, youth-centered care is really just about involving youth in the design and the implementation of their future healthcare. Because I mean, these clinics and the work we're doing is what's going to define our future healthcare system.
All of your insights are so true and definitely, resonate with many of us here. What's one positive or, memorable experience that you've had at a health center, and why did it stand out?
I can begin. I had a hard time that finding the motivation inside of me, and someone there gave an example of someone who's been through the same thing and was able to show me that it can be done, and I can do it as well.
I can continue. One of my first visits, I was super nervous, but the nurse actually took the time to ask about my school life and my interests, and I felt like it felt really human. It wasn't just like I was just another patient or like a chart.
What both of you highlight, really speaks to building, that trust as well as communication. And really thank you for opening up and being, sharing such a personal side, because that's something that doesn't always, happen, and feeling like you can bring that forth. And, really thank you for sharing on that aspect. What would you say, kind of leaning into that, building that trust and comfort so that you could feel, like you said, to find, the understanding yourselves, and being able to feel like you could, find what you needed here, not just the care, but also the experience as well. What does it take for the effort in health centers to create spaces that feel welcoming and judgment free?
I would say that there's many things health centers could do, but speaking from personal experience, I on the other flip side, I was able to facilitate a program with UT Southwestern last summer. It's called Health Street. It's a really unique program where we were able to provide like free screening in the Dallas community. And it was really rewarding because I was able to interact with like a diversity of people. And what was really, really important was not only providing like education, but also providing like destigmatization, or like battling any misconceptions that other people could have. So I think that like the number one things that health centers could do is like promote education while like battling any like misconceptions and providing like factual data. And I think that's the first step. And the second step is actually listening to youth, providing like a safe space by like catering and tailoring care specifically based on the way youth feel. I think those are really important steps.
Absolutely. Amaris, you've also talked before about, the importance of privacy, and bringing down those stigmas. What has helped you feel comfortable and respected in a health center?
To me, it's when the nurse explains my rights to confidentiality and respects my privacy. And like I talked about my first experience going there when I was super nervous, and when she took time to explain the steps of the procedure, or like I was getting a physical done and how everything was going to work step by step, it really made me feel really comfortable.
Absolutely. Elena, you've also talked about the importance of that, sharing the rights and the autonomy of care. What helps you feel like your voice matters during a visit? And how can providers navigate the balance between respecting your privacy and involving parents?
I would say when it comes to involving parents while respecting privacy, a big important part is educating the parents about what's going on with their child, because every parent wants to help their child, wants to see their child succeed. It's just a matter of how they can do it. And also setting boundaries, talking, communicating with both the child or the patient and the parent, and together coming up with a stable plan that shows what do we share, what do we keep to just between the patient and provider, and what's really the ultimate overarching plan that's going to happen.
Absolutely. And that also extends to even, you all have talked about education and awareness, and that can happen between provider and, student, as patient, provider and parent, but also the larger community and thinking on that level. So, Kari, with the great work that your SBHC has done, how have they worked to build trust with students and within your community?
So I have, I think, a pretty unique experience with my school's SBHC, just because we are so small. I think our high school through elementary probably has about 350 kids, and so everyone really does know everyone. But our health center focuses on outreach events. So we do the one that comes to mind specifically. We do a week-long program in October, November. It's called the Red Ribbon Rally, but it focuses on drug awareness. But it also gives us a front to provide different things like flu shots, and different educational things. But I think, like Amber said before, I think what makes that trust so strong is that everyone knows that everyone is human. And it's a very comforting experience because you're not focused on the fact that you're at a doctor's office. You're focused on the fact that you're with people that you know.
Absolutely. People that you know and that not only are there for you, but you understand where they're coming from, which really harkens back to that focus on the communication, and that, that good care isn't just about the services, that it's about the relationship. And so, as you think about, emphasizing that open communication, what would you say maybe, Elena, is one thing that providers should always ask or say to young patients?
I think one of the most important things that I know providers have said to me in school or their outpatient is that they're always there for you. They're on your side. They want to see you succeed, and that's their ultimate goal. They want to help you become the person that they know you can be. And I also think asking or telling them to respectfully say, or that you will respect them when they say, can you please not talk about that? Can we please move on to something else? Because the respect there for your patient is really important so that they know that they're being heard, but they're also being listened to. When they say they don't want to talk about something, they might not want to, maybe it triggers something for them. But I would say it's really important to remind them that you're there for them.
Absolutely. And that communication also can happen not just verbally, but also across social media or digitally. And so, Kate, and I know you focus a lot on the role of digital tools in health education. How can health centers utilize social media to really connect with young people, and what should they avoid?
Yeah, so I had a really interesting experience where I was able to work in a cross-institutional collaboration program with UCSF and Johns Hopkins, where I was able to work on an app called Healthy You. It's a sexual health app for screening for adolescents, and I'm currently trying to implement this at WashU in the WashU School-Based Health Center. But my experience with developing this app and kind of promoting it to youth and like marketing it is that social media could be a powerful tool because it kind of meets adolescents exactly where they are. Platforms like TikToks, Instagram, Snapchat could be used. And I think the health centers can actively use these platforms to lead maybe Q&A sessions, provide like quick tips, share like personal stories that youth could connect with, as well as testimonials. So I think that like moving away from strictly clinical language to more like colloquial, like youth slang, and providing like factual information and like could help health centers like develop genuine and consistent interactive content, which could definitely help like promote the connection between health centers and youth. Like as I said, social media is the best way to utilize, is the best thing to utilize because it meets youth exactly where they already are, especially with social media like rising. So I would say that those are just some ways that like social media could be utilized.
Absolutely. And Amaris, what are some other creative ways that you've seen or that you've led where health centers connected with young people either in the school or out of the school?
One of the coolest things my youth advisory council in New Mexico did was peer-to-peer education, where we had the students lead the conversation and education to other students about school-based health centers, mental and physical health. And to piggyback off what Kaden said, social media was a really impactful for the last few years for our youth advisory council. At the Be the Change conference last year, I led a workshop. Me and my other youth advisory council team members, we led a workshop talking about social media and the impact it has. And I think we can even see that today with the Ice Bucket Challenge, the USC promoting mental and physical health, and how big that's gotten.
Absolutely. And it really also is important what both of you have shared about not only utilizing it, but doing it with young people, like having them be the ones who are leading the channel, creating the content. So yes, it can be a tool that health centers or organizations can use to promote things that will be interesting to young people, but even better if it's actually, a counselor or youth themselves who are like really the ones in control of this channel and helping to share about themselves with you. So those are all really great insights. And as we've mentioned before, and for some who already know them, you all are doing really great work, both in your communities, but at the state and national levels. And so, for all of you, what does youth leadership look like when it's done right?
I would say one of the most important parts about youth leadership is communication, communicating to youth and also the like people that aren't youth that are supporting those who are younger, because we need to have the mutual connection between everybody that is in the part of helping youth, and communicating about all needs, all different backgrounds, all different stories, making sure everyone's needs are being listened to and met, and also creating a platform for inspiration and motivation to help people, find an environment that they're safe in and find an environment where they can speak up.
Anyone else have thoughts on what youth leadership looks like when it's done right or done really well?
I think that at least what I try and go by whenever I'm doing anything related to youth health, I think that youth leadership looks like lasting change. I think that to prove that what we're doing as youth matters is just making an impact again on what's going to be our future healthcare system and what is currently our healthcare system, because there's not much that we can do without support of others, but making an impact is something that can prove that we can do it.
And I can continue with that. I think youth leadership means that the youth have decision-making power and they're trusted to shape our future healthcare system.
Absolutely. And from the internship and shadowing experiences that you've had, Peyton, what's one maybe behind the scenes insight that changed how you saw school-based healthcare and, the role of youth in that work?
Yeah, I would say this is a good question. When I first began like my internship with the school-based health alliance or within even my own community, I assumed that like most of the barriers students were facing were logistical barriers in terms of like transportation, time, or cost. But in addition to logistical barriers, what I actually saw was how much the role of like emotional safety and trust influenced whether students like showed up at all. And I remember times where we had to work closely with like school counselors just to reassure students that screenings are private and judgment free. So I think my key takeaway from these experiences is that it's extremely important to support youth by not only solidifying their safety net, in addition to like mitigating any other like logistical or transportation barriers. But I think providing a safety net for youth, building a relationship with them, building trust, are very, very important. And that clinical care alone isn't enough. So I think that's my key takeaway from the internship experiences that I've had.
Very powerful. We need logic and heart. It's not just one or the other. And both you and Amaris and Kari, serve on youth advisory councils or boards, and inform a lot of amazing work and also lead it. How can health centers and organizations either start or support more youth-led initiatives? Any one of you?
I can start. So I think organizations can start to support more youth-led initiatives by starting to invest. That means like offering stipends, giving us leadership roles where we feel important, and making sure our ideas turn into like real action. And it's not just about like meetings, it's about like mentorship, like growth, and like leading us to something that we're going to do that is meaningful.
I think to start any kind of youth led organization, you need to probably narrow down what you want that organization to tackle. So, whether that'll be stuff within your school or your community, or if you want it to be broader and nationwide. After you figure out what you're going to want to do, you just need the kids, and there are youth that want to be involved. You just have to find them, because again, this is our healthcare, and we want to be able to make decisions, and we want to be able to have an impact. For support, I think it's really just about what you as an organization or a school-based health center can do for your communities or any student-led organizations near you. And so those will obviously be group wise. So, really, just reaching out to any organizations that you know of to see how you can make an impact positively on their organization or how you can contribute to what they do is just a huge way of knowing and letting them know that you support them and what they're doing as a whole.
Absolutely. Thank you both for sharing that. And it kind of takes us into thinking about as you're visioning and whether it's for, one person at an org and they're trying to get this started and lead it all, or maybe you already have an entire team devoted to this, it really does take being intentional at every level with those interactions. And not only, as you said, thinking about the now, but what's the future, and sustainability is so important. Kari, I want to ask you, in terms of recommendations for how health centers can form those stronger partnerships, anything additional you would say as you've worked with both leaders in the community and been on some state leadership work? How do you branch out to the wider community, the SBHC, but how do they engage larger or think about big picture change?
Yeah, it's really about your outreach and what your focus is. So I started at my school and I started with a youth advisory council for our school-based health center. And then eventually I learned that the youth or the School-Based Health Alliance of Arkansas was wanting to involve some kind of youth program. And so I reached out, I was appointed, and I think that just demonstrates that all you have to do to branch out is to be aware of what you want accomplished and know that you can do it. It'll take time, but as long as you know what you're doing and you know what you want to do, it's simple, really. Again, I think reaching out to as many student-led organizations that you know of is a huge way to continue to foster those relationships. But again, starting that board or increasing your outreaching events, just making other people aware of what you're doing and why you're doing it is just a huge way to continue that impact.
Absolutely. And we've talked a lot about all the positive ways and things that can happen, and how to move forward in a light that continues to elevate and expand things. And as we think more about that, Elena, you've talked about the value of being seen by providers who understand you. So how can health centers reflect that same type of sentiment and message to the youth that they serve?
Yeah, I think it's really important to have providers in especially like a high school, if it's a school-based health center, in a high school to have many providers that have a young age, ones that have more recently been through high school, more recently had these experiences that these students are having now. It's more relatable. They can really connect deeper down to them because they've been there more recently. And I also think it's really important to have providers with a variety of backgrounds so that when a student is meeting with a provider, the provider can say, I've been there and I've gotten through it. You can get through it too. I know exactly what you're feeling because I have a similar experience. So if you have a variety of backgrounds, you can connect to a wider range of students and really get more students help.
Absolutely, that relatability factor, and not just, keeping that to oneself. Of course, you have to be protective of your own background and the things that are shared, but it is important to at least be able to verbalize, like, I really do understand, and I've been where you are, to make that connection aspect. Um, One last note, from each of you that you would want everyone today to remember about working with young people, or that you hope they will take from this and go forward with.
I think I can start with this. I think the most important thing is to remember that young people aren't just recipients of healthcare, but they can also become partners and leaders, and even innovators who are capable of like helping with profound contributions. And I think that especially in the healthcare space, it's extremely important to remember this. And I think that it's important to also remember that involving youth in decision making can also lead to like creative solutions that you may have never thought of, or adults may never thought of. It's just because youth connect better with youth. So involving them in like decision making is extremely important. So I think the one main takeaway is to foster like youth adult collaborations, but also genuine like trust with youth, build relationships with them. And I think that doing so could help like advance healthcare into the future. So I think it's really, really important to remember that like youth are not just patients, they're not just recipients of healthcare, but they can actually get involved in healthcare and become leaders in that space.
I can go next. I think my main takeaway is to remind adolescents and young clients that their voice matters. Your ultimate goal is to see them succeed and thrive in every way possible, and you are there for them. You're catering to their needs. You're there for them.
I think that it's just extremely valuable to remember that you create the platform that youth have to represent their voice and to speak up about things. It's your responsibility as adults and providers to respect us and to just listen and implement what we say, or understand that where we come from, we're coming from the people that are directly receiving these services. And so what's extremely important to us is stuff that we want implemented.
And to add on to that, I would say my main takeaway is that we don't need you to speak for us. We need you to speak with us, and sometimes to take a step back and let us speak first, because when youth are empowered, more lasting change can be implemented.
I don't think any of us could have said it better, and that's why they said it themselves. Thank you all so much. We definitely will open up for any questions that those in the audience will have. But other than that, turn it back over to Tony and Mandy.
Wonderful job. You're getting a lot of praise in the chat. We have a post poll ready in a moment. And then this should just take you a couple minutes, 5 questions, so that we can focus on continuous improvement. We'll give that a few moments. And then once you're done with that, if you have questions, you can start putting those in the chat. Getting a lot of praise in the chat. And then if you have any other questions, we can save the last 10 minutes or so to answer those. We'll give it another 2 minutes again. If you haven't started, it's just 5 questions. Shouldn't take you too long. Give it 1 more minute to just answer those quick 5 questions for the poll. Thank you. And while we give you another minute to just wrap up that poll, these are some ways to stay connected. You can scan the QR code. Just as they were saying, social media is very important. This allows us to share when we have other sessions like this and other opportunities to learn and engage with us. So you can check on the Facebook page, the Twitter page, LinkedIn, and Instagram. And we'll leave that up for another minute or so. Then we'll toss it back over to Selena, and then we can get into some questions.
Yes, the next slides that we can also share are for how you can connect with additional work that we have going on here at SBHA. So if you want to talk more about youth development, and definitely you'll hear from each of our panelists about their ideas for starting accounts or getting students recruited. We also offer a lot of great resources around that as well. And so you can look on our youth development website. We also have a youth-focused one, youthhealthhub.org, which is full of content from wonderful youth and is informed by our council. If you're not signed up to our monthly digest, please definitely sign up for that so you can hear about the great work that our council is doing and youth across the country. And be on the lookout for more information about this year's Be the Change youth training program. And last but not least, if you want to do more of a deeper dive and work hand in hand to create any type of youth development opportunity, we have consulting available. And then we also have a way for you to connect. You can scan that QR code to get access to all of those resources that were just there. So if you didn't get it there, you can scan it here as well. And be sure to follow our council on Instagram and Twitter.
All right. Thank you so much. We do have some questions in the chat. So I'll let Donnie move the slides around. One question was to go back to the QR code page for social media. So it looks like there are 2 QR codes, Donnie. Thank you. The first question is from Lisa. If people don't have funds to support a student internship, are there other incentives to get students to attend YACS?
I think that's a good question. I think the most important thing is to kind of talk about like the real, or like make youth understand that they can make like a real impact if they get involved in the YACS, as well as like another thing that's important to youth is like the resume building component. So talk about how they can get like really impactful leadership and like help to better the lives of others. If you don't have enough funding to like provide incentives, I think those are the 2 like key ways to recruit youth specifically to get them to attend YACS.
Anybody else want to say anything before I jump into the next question?
I'll just add that for those, if you are thinking about starting one or you have already started it and you're meeting in person, for those who are happening at the local level, maybe in the schools, definitely incentivize around the time of day if you can. Some of them happen during lunch, and so then the students are able to get their lunch, and then you come to the SBHC to have your meeting, so then you can avoid the before and after school, how are they gonna, get home or what have you. And if you're one that's happening at, the city level or even state level, again, if you're meeting in person, if you at least maybe we're going to have dinner, we're going to have food, that, can be enough of an incentive to say, and now let's do great work together.
To add on to that, I was going to say free food at meetings too, community service hours or school credits, if allowed, maybe like certificates of participation or letters of recommendation, and even just making the space super fun and welcoming can be really meaningful and like a huge motivator.
All right. What suggestions do you have reaching out to students as we are in the planning stages of a school-based health center, particularly in a more political community?
I think that just talking to your students, especially through social media, I know we have kind of honed in on that, but I believe that's because it's a huge part of advertisement right now. So really focusing on letting your students know, whether this be again through social media, word of mouth. This could be like a presentation that you do at a school, or if this is a community-based youth action council, it can be to multiple schools. Or it can be a community function, but also doing outreach events that can be either run or sponsored by your school-based health center once it is set up. I think that's a huge thing that promotes involvement and enrollment within all centers.
And piggybacking off of what she said, I would say especially if it's in like the planning process, it's a great time to have an assembly at a school or really show people that there's going to be something that can help them, and finding maybe just one person while it's in the planning process, not completely made up yet, just one person that they can reach out to with questions or for help.
And just, elaborate on that, making multiple options for engagement. Like they said, it could be surveys, and you might also be thinking about doing that with parents as well. So there's a survey for you to get parents' feedback on what they think about the center, the students, other community members. Then you might host focus groups. I know many, when they started their planning phase, they already knew there was, within their community that there's different fairs or, or festivals that everyone goes to. So being able to set up there and share about it, or just passing out information, or they know that maybe you've already just figured out in your planning stage what school you're starting with. So starting there, if is there a PTO or PTA, is there already some student groups there that would be engaged or like-minded. Some have even looked to connecting with if schools have different thinking, if it's in a high school that you're starting with, they might have pathways. And so I know with one's health center I work with, as they were looking to start up, there was already a health careers pathway in the school, and that teacher was willing to give time for the health center staff who were thinking about the SBC to come in and just be able to talk with students, find out what they're interested in as it relates to health, what their needs are, where they're already going in the community and why that works, where they're not going and why it doesn't work, to then say, hey, if we put a center here in the school, would you use it? What would you think about it? So thinking about those different aspects of where everyone already exists or goes, and to partner in those ways.
I would say if you're going to try to advocate for school-based health centers in a more conservative place, I would say focus on the good. So like it increases better attendance, stronger mental health, and it provides tools to increase like less absences, and it keeps kids in class healthy and ready to learn.
This is a bit more broad. So if you haven't answered yet, or you have something on the tip of your tongue, what ideas do you have for recruiting students to a YAC?
I think targeting students that are interested in any kind of healthcare field is a really good way. Again, this can be through an assembly or a presentation, word of mouth. I think that's probably the demographic you want to start with. But obviously, that is not who's limited to joining. But when we're talking about letters of recommendation or resume add-ons, focusing on a small demographic first would probably benefit most, and then you can branch off to different groups once you've formed some kind of youth group or youth initiative within those people.
Yeah, just adding on to that, in addition to like the classrooms and clubs like you talked about, I think it's important to also, you could leverage like peer networks. So maybe like current or past members could personally like invite their friends or classmates. Like through word of mouth, youth will understand the importance of like a yak. And then also like maybe like working with teachers, counselors, and other coaches to encourage students who like would not like self-nominate, maybe talk to them on like a one-on-one basis to see if they'd be interested in joining the yak. And then lastly, utilize like visuals and stories. So I've seen a lot of posters here around WashU for different like yaks, engage social media. I think those are just some ways you could kind of recruit students to yak. So
For those who, if you're starting this council, both in a school-based setting, but for those who are not in a school-based setting and they're not connected to that, and it's a health center program and you're in the community and you're wanting to start a council, you can also think about those, sometimes they're referred to as your frequent flyers, those who you see a lot, who come in for any number of reasons to the health center. They're there already and maybe know a lot, and they might just be interested in saying, hey, would you like to work with us to inform us some more? Are you interested? So you also have the side of those who've already expressed interest, as mentioned, about being in health, but you have those who maybe no one's even asked them before. And this could be a way to get them started thinking about a career. So just the sheer frequency that you see them are ready for care, they might want to, impart on another side and inform what's happening.
Great. Any other thoughts you have that you want to share? There's no pressure, but your opportunity to share any things that are on your mind as it relates to getting youth engaged in school-based health. Okay, any other questions?
I do see another in the chat. What do you think?
Yep, go for it.
Oh, what do you think you spend their time doing after school? And what do you suggest for those youth that do not have a lot of access to transportation?
I would say, from personal experience being like social with people, a lot of people after school, youth spend their time on their phones, soaking up information from social media that is not always beneficial. I think, especially those struggling with mental health, if you don't have access to transportation, maybe find an online support group to use your social media and your devices as a coping skill and as something that can help you and benefits you. So, finding an online support group or somebody that you can communicate with, an online therapist that's maybe you don't have to pay for, something like that to really get support and help, and also just someone to talk to.
Yeah, and in addition to that, I think it's also important to like bring programs to where youth are already are. So maybe like at school campuses, like after school activities or local community centers at the schools themselves. So youth don't have to worry about like transportation. And then I think also, like Elena said, like offering virtual options when possible is extremely important. So because that also increases accessibility for youth who may not have access to transportation.
I think just like he said, doing things on campus is extremely important and kind of eliminates the need for any extra transportation or anything else that would be needed. But you could also implement these meetings or whatever it is you're wanting to do during school hours, so you're not extending past school time. So there really is no need to change any kind of transportation mode. It'll still be the same schedule as before.
Great. And we just got another question, which is, have any of you done a workshop on students and mental health? And if so, how was it received by students?
I guess I can take this one first. Last year at the National School Based Outlines Be the Change Conference, I, alongside one of my friends, facilitated a workshop on destigmatization of mental health and promoting like mental health resources. And I think like each of us gave our like personal experiences with mental health and like reaching out for help. And I think it was perceived like really well by both students and adults, and we had some like fun activities for youth as well to keep them engaged. So I would say that like overall, I think it was a really good experience. And yeah, they definitely work. Something that's really important in those workshops is emphasizing like personal stories, personal connection, and the importance of providing like education and resources to youth. So
I would also say I attended that conference, and I thought a big part of it that helped students keep engaged is really doing interactive activities, having them talk, having them say things to each other and share things, and also just activities to keep them engaged.
I agree with what Elena said, and also offering incentives. I think we offered like Chipotle gift cards at the workshop that I was leading last year, and then also keeping it anonymous. It just makes it more open and like less nerve-wracking to share your personal story when it's anonymous.
I was also at the conference, and I think that everyone appreciated the fact that the entire workshop was based on normalizing mental health like it should be. And a lot of it really focused on how that mental health really impacts you throughout your life rather than just when it's happening. And again, activities that kept everyone involved, opportunities to allow people to share personal stories kind of just really furthered the personal connection that everyone was getting, because we were talking about a topic that affects everyone. It's not something that's going to be catered towards a certain group. It's something that affects everyone throughout all of their life.
Great. All right, I think we can wrap with a thank you and sharing the social media links if we can. Thank you so much for joining us today. We will send this recording out in an email to those that attended. We appreciate you, and we'll stick around in case you had any last questions.
Okay, thank you so much.
Thank you.